Parkinson's disease is a complex neurodegenerative disorder, and its exact etiology remains unclear. However, research suggests that a combination of genetic and environmental factors contributes to the development of the disease. Here are some key factors associated with Parkinson's disease. 1. Genetic factors. Several genes have been implicated in the development of Parkinson's disease. Mutations in specific genes, such as SNCA, LRRK2, PARK2, PARK7, and PINK1, have been linked to inherited forms of the disease. These mutations can disrupt normal cellular processes, leading to the accumulation of toxic proteins, oxidative stress, and mitochondrial dysfunction. 2. Environmental factors. Exposure to certain environmental factors may increase the risk of Parkinson's disease. These factors include pesticide and herbicides, such as rotenvan and paraquat, heavy metals, like lead and manganese, industrial chemicals, such as trichloroethylene, and rural living or well water consumption. These environmental toxins can induce oxidative stress, inflammation, and damage to dopaminergic neurons in the brain. 3. Neuroinflammation. Inflammation in the brain, particularly chronic activation of microglial cells, the immune cells of the central nervous system, has been implicated in Parkinson's disease. Inflammation can contribute to the degeneration of dopaminergic neurons and the formation of Lewy bodies, abnormal protein aggregates found in the brains of Parkinson's patients. 4. Mitochondrial dysfunction. Mitochondria, the energy-producing organelles within cells, play a crucial role in neuronal function. Dysfunction of mitochondria can lead to impaired energy production, increased oxidative stress, and the release of toxic substances, ultimately causing neuronal damage. Mitochondrial dysfunction is thought to be involved in Parkinson's disease pathogenesis. 5. Protein aggregation. In Parkinson's disease, there is an accumulation of abnormal protein aggregates, including alpha-synuclein, which forms Lewy bodies. These aggregates can disrupt cellular processes and lead to neuronal dysfunction and cell death. 6. Oxidative stress. Oxidative stress, an imbalance between the production of reactive oxygen species, free radicals, and the body's ability to detoxify them, is believed to contribute to the progression of Parkinson's disease. Oxidative stress can cause damage to cellular components, including DNA, proteins, and lipids, and can trigger neurodegeneration. Parkinson's disease is a neurodegenerative disorder characterized by the progressive loss of dopamine-producing cells in the brain, particularly in the substantia nigra. Dopamine is a neurotransmitter that plays a critical role in movement control, and its deficiency leads to the characteristic motor symptoms of Parkinson's disease, such as tremors, rigidity, bradykinesia, slowness of movement, and postural instability. The pharmacological management of Parkinson's disease primarily focuses on restoring dopamine function in the brain and alleviating the motor symptoms. The main classes of medications used in the treatment of Parkinson's disease include 1. Levodopa, L-dopa. Levodopa is the most effective and commonly used medication for Parkinson's disease. It is a precursor of dopamine that can cross the blood-brain barrier and is converted to dopamine in the brain. Levodopa helps replenish dopamine levels and improves motor symptoms. However, long-term use of levodopa can be associated with motor fluctuations and dyskinesias. 2. Dopamine agonists. These medications directly stimulate dopamine receptors in the brain, bypassing the need for conversion like levodopa. Dopamine agonists can be used as monotherapy in early-stage Parkinson's disease or in combination with levodopa in advanced stages. Examples of dopamine agonists include pramipixole, ropinirole, and rotigotine. 3. Monoamine oxidase B (MAOB) inhibitors. MAOB is an enzyme that breaks down dopamine in the brain. MAOB inhibitors prevent the breakdown of dopamine and increase its availability. They are often used as adjunctive therapy to levodopa. Commonly prescribed MAOB inhibitors include selegiline and rasagiline. 4. Catechol O methyltransferase (COMT) inhibitors. COMT is another enzyme involved in dopamine metabolism. COMT inhibitors block the breakdown of dopamine and prolong the effects of levodopa. Antasipani and tolsipani are examples of COMT inhibitors, with tolsipani being reserved for specific cases due to potential liver toxicity. 5. Anticholinergic agents. These medications reduce the activity of acetylcholine, a neurotransmitter that is usually in excess in Parkinson's disease. By rebalancing the dopamine-acetylcholine ratio, anticholinergics can help control tremors and rigidity. They are typically used in younger patients with tremor-dominant symptoms. 6. Amantadine. Initially developed as an antiviral medication, amantadine has shown modest effectiveness in managing Parkinson's disease symptoms, particularly dyskinesias. Its exact mechanism of action is not fully understood, but it is believed to enhance dopamine release and block glutamate receptors. In addition to these medications, other therapeutic approaches for Parkinson's disease include deep brain stimulation, DBS, which involves implanting electrodes in specific brain regions to modulate abnormal neural activity, and physiotherapy, occupational therapy, and speech therapy, which can help improve mobility, independence, and communication skills.